So I want to tell you a little bit about my story, and my story really starts back to when I was first working as a nurse very soon after college, and I was working in a medical ICU. Very stressful job, high patient ratios, and like a lot of the nurses on the call here, I wasn't able to take care of myself in that environment. You know, we talk about, you know, we would brag about not how long we could go without running to the bathroom because we had patients to take care of. Or, you know, you'd skip your lunch break because, you know, patients needed you. And I know a lot of us, we give our whole hearts and our whole selves into our jobs because it's our passion, it's what we do. And that's where I found myself. I was in my mid-20s, but I was really suffering. I had high blood pressure. I was having chest pains. And I even had my lab values were off. My cholesterol was rising, and I was in a healthy looking body. I was in my small scrubs, but I was, you know, running ragged in trying to help people get healthy. And by doing that, causing myself a lot of harm. So fast forward a little bit, I had my kiddos. You can see my two boys there on the screen, my heart, and I got to take some time off work to get to be a mom to those little guys. Once they got a little bit bigger, I started thinking about going back into the workforce because I love helping people. It's my passion. I love health and wellness. But the thought of going back into tertiary care and into the environment of healthcare as it was something I did not want to do. My heart is in prevention. I wanted to help people prevent diseases. I wanted to keep people out of the ICU. I wanted to help my friends and family that were around me that were always asking me questions about getting healthy, but I didn't have a tool to help them. And going back to 12-hour shifts, going back to night shifts, going back to the hospital wasn't going to give me that tool that I desperately was searching for to help those people in my life and to help more people outside of my inner circles to create wellness. So as you can see, wellness is a very big deal. And it's something I think that is maybe a term that sometimes we gloss over, or it seems like this big shiny thing that people don't really understand.
Well, talk a little bit more about how you have taken the idea of wellness and incorporated it into your daily life. So you're a mom, you're a health coach, you're a wife. I mean, how does that fit into your world? I mean, how does this whole idea of health coaching coincide with your work schedule and your kids' schedule and all that kind of stuff?
Absolutely. Well, one of the big things about wellness and something that I think is super important for all of us is balance. And health coaching has provided me that great balance in my life, in all the things I want to do. So through this program, I was able to really look at my healthy habits, look at my life, and find out maybe where I was a little askew. Of course, nobody's ever in complete balance, but this program really helped me look at my nutrition and look at my activity, look at how much water I was drinking, how I was managing my stress levels, and really come together and create that in myself, and then give me those tools to help other people in my life create that.